Hi there, this is a video for anyone who has had head and neck cancer and maybe had some radiotherapy to their tongue, their throat, their face, some surgery, lymph nodes removed. This is just a few stretches that you can do to help keep all this, the fascia within all of this area a bit looser. You know, when we stretch all the tissue underneath, you know, in the neck area and the chest area, it actually affects all the connective tissue or the fascia within the underneath structures as well. So around the tongue, with the swallow function, so you can help keep all that as mobile and sort of free as you can, and it may help with the swallow. So first of all, you take some nice shoulder rolls. Nice and slow, big round circles. We do 5 each way while taking some nice breaths, nice belly breaths. There's a lot of lymphatics in the belly, so you want to just squeeze those with your diaphragm when you breathe. Now you take some bigger arm circles. If your range of motion is a bit more limited, then that's fine, just go to where you can go. Nice breaths as you come up, in breath and out, in and out, in and out. You can also do sort of one arm the other way if you want. Just keep that shoulder girdle a little bit more free. Often if you have radio to this sort of area, it does come through to the back, through to the rotator cuff, so it can affect that range of motion in your shoulder. Okay, so now you're going to do some neck stretches. First of all, ear to shoulder, just to where you comfortably can go. Back to neutral, other side, back to neutral. You know, do 3 or 4 each side. Now you're going to turn your nose and look around over your shoulder, just so you can feel the stretch. Come back to neutral. 2 and 3. Now you're going to do nose to nipple. So you're looking down, sort of a diagonal stretch, up to neutral, looking down. Just do that a couple of times. Back to neutral. Now you're going to look up, not looking too far back, just until you feel a stretch in the throat. Looking down, looking up, looking down. Little rotations. Just being really mindful not to go too far back, not to let your head go. Really slow, mindful rolls. Feeling all those little creaks opening up. Okay, so now you're going to stretch your mouth and your jaw and your tongue. So this may look a little weird, but that's all right. So you're going to stretch your mouth. You know, stretch your jaw. With your tongue, out with your jaw, in with your neck like you're a turtle, out, tuck it in, out, really feel that stretch, tuck it in. Okay, now you're gonna roll your tongue, so stick your tongue out as far as you can without causing any pain. So I did rolls either way, and then I did north, south, east, west, whatever that direction is. Never eat your beat. And also this is a really good one to strengthen the inner muscle, the platysma here, with the tongue. So you form an O with your mouth, and then you're gonna push your tongue into each cheek 20 times. So do your O. I did 20. You can do up to 30, you can do less if the tongue is still sort of very tight and sore. Make sure you're far away from surgery, you know, at least 8 weeks after surgery before you do any of those tongue ones if you've had tongue surgery. And then just shoulder rolls to finish with a nice breath. Okay, so that's just the stretches. You can do those wherever, like when you're in the car, at the traffic lights, when you put the kettle on. Just try and sort of cement it into something that you want to do, and it will remind you just to do those stretches daily if you can, and it will really help keep the lymph moving. You know, if you are at risk of lymphedema if you've had radio and surgery of the neck. And on my next video I'm going to show you a few lymphatic drainage moves to do just to keep all that nice and soft, and yeah, draining freely to avoid lymphedema, prevent lymphedema. Okay, thanks a lot, bye.